Hey, my name is Ashley, and I'll be talking about exercise prescription for those who have chronic kidney disease. So, how this disease is diagnosed is the individual takes a microalbumin test, and that test determines how much blood protein is in the urine, or they have a filtration rate of less than 60 milliliters per minute per 1.73 meters square, and that filtration rate occurs for about 3 months. A normal filtration rate would be 90 to 120. About about 23 million Americans have this disease, and the prevalence of this disease is about 11.5%. Uh, Hypertension, diabetes, and cardiovascular disease are very common in this population, and the prevalence of the comorbidities raise with each stage of the disease. And there are five stages of this disease. So once a person has reaches stage five, um, their only option is to be put on dialysis or have a kidney transplant. There are two forms of dialysis. There's the hemodialysis, where they put a port in your arm, and what it does is take the blood that's currently in the body, takes it out, it filters it, and then brings the purified blood back into the body. And that can take up to about 4 hours. The peritoneal dialysis, that's when they fill up the abdomen with the dialysis fluid. They let it sit there for a day or so, and then they drain it back out. And what that fluid does is remove the toxin from the blood. It filters it. It takes the toxin from the blood, and then once it's drained, all the toxins are drained out with it. Because cardiovascular disease is the major cause of death in this population, diagnostic exercise testing is indicated. So exercise testing is included in the pre-transplantation workup for kidney recipients. And the exercise test should be supervised by trained medical personnel with the use of standard test termination criteria and test termination methods. Before doing an exercise test, medical clearance must be obtained from both the patient's primary physician and their nephrologist. The standard exercise testing procedures can be done for those who are in stage 1 through stage 4, but those who are in stage 5, the exercise testing should be done on the day on non-dialysis days, the days they don't do dialysis. And the blood pressure should be monitored in the arm that does not contain the arteriovenous fistula. So that's the port that I was talking to you about that takes the blood out, filters it, and then brings the blood back in. So it's that port there. Patients receiving peritoneal dialysis should be tested without the fluid in their abdomen. Both treadmill and cycle ergometer protocols can be used, and because of the low functional capacity in this population, and more conservative treadmill protocols such as the modified Bruce protocol are more appropriate. If the cycle leg ergometer is being used, you want them to do a warm-up at a work rate of 20 to 25 watts, and you want to increase the work rate by 10 to 30 watts, and do that every 1 to 3 minutes. In patients receiving hemodialysis, their peak heart rate is going to be about 75% of their age predicted max. Because the heart rate may not always be a reliable indicator of exercise tolerance in these patients, the RPE should always be monitored. Isotonic strength testing should be done using a 3 RM or higher workload, because 1 RM testing is generally thought to be a contraindicated in these patients because of fear of spontaneous spontaneous avulsion fractures. The exercise prescription for these individuals for aerobic exercise, you want them to do 3 to 5 days per week at a moderate intense exercise, so 40 to 59% VO2 reserve. You want their RPE to be 11 to 13 on a 6 to 20 scale. You want them to do about 20 to 60 minutes of continuous exercise. But for those who can't do that right away, 3 to 5 minutes of intermittent exercise is just fine. Just do enough where it accumulates to about 20 to 60 minutes. The type of exercise that's recommended, they want you to walk, cycle, or swim. Those are the recommended aerobic exercises for them. For resistance training, they want you to do 2 to 3 days per week, 70 to 75% 1 RM, and you just choose 8 to 10 different exercises to do, and make sure they work the major muscle groups. And they can use either the machine weights or the free weights. And flexibility should be performed following the guidelines for the healthy adults. So more than or equal to 2 to 3 days per week, and holding the stretches for about 10 to 30 seconds. Special consideration, depending on the clinical status and functional capacity of the individual, the initial intensity selected for training should be light, so 30 to 39% VO2 reserve. And they can do it for as little as 10 to 15 minutes, or whatever the person can tolerate. And duration should be increased by 3 to 5 minutes each week until they complete 30 minutes of continuous exercise before increasing the intensity. So keep it at a light intensity until they can reach 30 minutes of exercise. And once they've reached 30 minutes of light intense exercise, you can bump them up to maybe moderate. Clinical status of the individual needs to be considered. The progression may need to be slowed if the individual has a medical setback. Some individuals are unable to do continuous exercise, but should perform intermittent exercise. Some as short as 3 minutes, followed by a 3-minute rest. So you want it to be a 1-to-1 work to rest ratio. And the person should be asked to do one set of 10 reps at 70% 1 RM twice per week. And consider adding a second set when the individual can easily complete 15 reps at a specific weight. Those on hemodialysis, exercise can be performed on non-dialysis days and should not be done immediately post-dialysis. So on the day that they do that dialysis, they should not exercise on that same day. If exercise is done during dialysis, exercise should be attempted during the first half of the treatment to avoid hypotensive episodes. Place great emphasis on the RPE because the heart rate is unreliable. Patients may exercise the arm with the arterial venous axis as long as they do not directly rest weight on that area. Measure blood pressure in the arm that does not contain the fistula. Peritoneal dialysis. Patients on the peritoneal dialysis may attempt exercise with the fluid in their abdomen. However, if this procedure discomforts them, then they should be encouraged to drain the fluid before exercising. Recipients of kidney transplants, during periods of rejection, the FIT principle should be reduced, but exercise can still be continued.